Have you ever wondered what might be happening inside your body at this very moment, while everything on the surface feels completely normal? You wake up, go to work, scroll through your phone, laugh with family, and carry on with life, never suspecting that deep within your arteries, silent pressure could be building with every heartbeat. High blood pressure does not knock on the door. It does not always bring pain or dramatic warning signs. Instead, it moves quietly, patiently, often for years, while millions of people walk around feeling perfectly fine, completely unaware that their blood vessels are under constant strain. It is this silence that makes hypertension so unsettling. There is something deeply uncomfortable about the idea that your body could be under stress without your knowledge, that every single heartbeat might be pushing just a little too hard against the delicate walls of your arteries. Over time, that invisible force can slowly wear the body down, not in one sudden moment, but in a gradual, almost unnoticeable way. Many people who eventually discover they have high blood pressure are shocked because they never felt anything was wrong. Life was busy, routines were normal, and nothing seemed urgent enough to question. Yet inside, the pressure continued, day after day, night after night, like a quiet engine running too hot for too long. What makes this even more concerning is how common it has become in the modern world, affecting people of different ages, lifestyles, and backgrounds. It does not always look the way you expect. Sometimes it lives in people who appear healthy, active, and energetic. Sometimes it hides behind everyday stress, poor sleep, long work hours, or simply the natural aging process. And because it is so often silent, many people only learn about it when their bodies have already been under strain for years. That thought alone is enough to make anyone pause and reflect. Right now, as you listen, your heart is beating steadily, faithfully doing its job. But the question that quietly lingers is this: is it working under normal conditions, or is there more pressure than there should be? This is not about fear for the sake of fear. It is about awareness, about understanding that some of the most serious health threats are the ones that do not announce themselves loudly. Hypertension has earned the nickname of the silent killer for a reason, and that reason lies in how easily it can exist without obvious warning, while still placing real stress on the body over time. The good news is that knowledge changes everything. The moment you begin to understand what might be happening beneath the surface, you take the first powerful step toward protecting your health. And as you continue watching, you may start to connect certain dots in your own life, noticing patterns you never paid attention to before. Because sometimes the most important health stories are the ones unfolding quietly inside us right now. High blood pressure, also known as hypertension, is a condition where the force of blood pushing against the walls of your arteries stays consistently higher than it should be. To understand this in simple terms, imagine your arteries as flexible pipes that carry blood from your heart to the rest of your body. Every time your heart beats, it pushes blood through these vessels. Normally, this pressure rises and falls in a healthy rhythm, giving your blood vessels time to relax between beats. But with hypertension, that pressure remains elevated more often than it should, which means your arteries are constantly under extra strain. Over time, this added force can make the artery walls less flexible and more vulnerable to damage, even though you may not feel anything unusual happening. That is what makes this condition so tricky and so important to understand. Many people think of high blood pressure as a momentary spike caused by stress or anxiety, but true hypertension is different. It is not just one stressful day or one bad reading at the doctor's office. It is a long-term pattern where the pressure inside your blood vessels stays too high across multiple readings and over an extended period. Because your heart and blood vessels are incredibly strong and adaptable, they can handle this extra pressure for quite a while without sending clear warning signals. This is why so many people live with hypertension for years without realizing it. The body quietly adjusts, compensates, and keeps going, even while the constant pressure is slowly affecting the delicate inner lining of the arteries. Another important thing to understand is that blood pressure is measured using two numbers, often read as systolic over diastolic. The top number reflects the pressure when the heart actively pumps blood, and the bottom number reflects the pressure when the heart relaxes between beats. In hypertension, one or both of these numbers remain consistently elevated beyond the healthy range. Doctors usually confirm the diagnosis only after multiple readings on different days, because they want to be sure the high pressure is truly persistent and not just temporary. What makes hypertension especially important is not just the number itself, but what that number represents inside the body. Constant high pressure forces your heart to work harder than normal, and over time, this extra workload can place stress on many vital organs, including the heart, brain, kidneys, and eyes. Yet despite all this internal activity, many people feel completely normal, which is why regular monitoring becomes so valuable. Understanding what hypertension really is helps remove the mystery and replaces it with clarity. It is not simply about feeling stressed or tired. It is about the steady force of blood flow and how your body manages that pressure day after day. When you truly grasp this concept, you begin to see why awareness and routine checks are so powerful. By knowing what is happening inside your body, you give yourself the opportunity to notice changes early, ask the right questions, and take thoughtful steps toward protecting your long-term health and well-being. When we talk about why blood pressure becomes high, it is important to understand that in many people, there is not just one single cause, but rather a gradual buildup of different factors that quietly push the pressure upward over time. In most adults, hypertension develops slowly as the body changes with age and lifestyle habits begin to influence how the heart and blood vessels function. One of the biggest contributors is long-term stress on the arteries. When blood vessels become less flexible and slightly narrower, the heart has to push harder to move blood forward, and this naturally raises the pressure inside the system. Genetics also play a meaningful role. Some people inherit a tendency for higher blood pressure from their parents, which means their bodies are naturally more sensitive to salt, stress, or hormonal changes. This does not mean high blood pressure is guaranteed, but it does mean the body may need more careful attention and healthier daily habits to keep numbers in a safe range. Lifestyle patterns are another major piece of the puzzle. Diets that are consistently high in salt can cause the body to hold on to extra fluid, increasing the volume of blood flowing through the vessels and raising pressure over time. Lack of regular physical activity can also contribute, because movement helps keep blood vessels flexible and supports healthy heart function. When the body becomes more sedentary, circulation can become less efficient and pressure may gradually rise. Excess body weight adds another layer of strain. The heart must work harder to supply a larger body with oxygen-rich blood, and this extra workload can slowly push blood pressure upward year after year. Sleep quality is something many people overlook, yet poor or interrupted sleep can quietly affect hormones that regulate blood pressure, especially when sleep problems continue for months or years. Chronic stress and constant mental tension also influence the body more than most people realize. When the body stays in a prolonged state of alertness, stress hormones can keep blood vessels slightly tightened, which over time contributes to sustained pressure elevation. Certain medical conditions, such as kidney problems or hormonal imbalances, can also interfere with the body's natural pressure controls, though in many cases, hypertension develops without a single clear medical trigger. What is especially important to understand is that these factors often work together, slowly and quietly. High blood pressure rarely appears overnight. Instead, it builds gradually through daily habits, inherited tendencies, and subtle changes inside the blood vessels that most people never feel happening. The reassuring part is that awareness of these causes gives you real power. When you begin to recognize the patterns that influence blood pressure, you are no longer in the dark. You can start making informed choices, paying attention to your body, and working with your healthcare provider to keep your numbers in a healthy range. Small adjustments made early and consistently can make a meaningful difference over time. By understanding what drives blood pressure upward, you take an important step toward protecting your heart, supporting your circulation, and giving your body the calm, balanced environment it needs to stay strong for years to come. One of the most important things to understand about high blood pressure is that many people feel absolutely normal while it is developing, which is exactly why it is often called a silent condition. In the early and even middle stages, hypertension usually does not create strong, obvious warning signs that force you to stop and pay attention. A person can wake up, go to work, exercise, and carry on with daily life without any clear signal that their blood pressure has been elevated for months or even years. However, in some individuals, the body does begin to send subtle hints that something is not quite right. Some people report frequent headaches, especially a dull, pressure-like discomfort that seems to linger without a clear cause. Others notice episodes of dizziness or a lightheaded feeling that comes and goes, often brushed off as simple fatigue or dehydration. There can also be moments of blurred vision or eye strain, which may feel temporary but can be connected to the effect of sustained pressure on delicate blood vessels in the eyes. Occasionally, people describe a sense of pounding in the chest or being more aware of their heartbeat during quiet moments, though this is not always present. Shortness of breath during mild activity can also appear in some cases, especially if the heart has been working harder for a long time. What makes this condition particularly deceptive is that these experiences, when they do occur, are often mild and inconsistent. They do not always happen together, and they may disappear for days or weeks, giving a false sense of reassurance. Many patients tell me they assumed their symptoms were due to stress, lack of sleep, or simply getting older. In reality, high blood pressure can quietly affect the inner lining of blood vessels long before symptoms become noticeable enough to raise concern. In more advanced situations, if blood pressure rises to very high levels, the body may send stronger distress signals, such as more intense headaches, chest discomfort, unusual fatigue, or a feeling of pressure in the head. But the goal is never to wait for these stronger warnings. The safest and smartest approach is to recognize that absence of symptoms does not equal absence of risk. This is why routine blood pressure checks are so important, even when you feel completely fine. Think of it as listening to a quiet conversation inside your body that you cannot hear without the right tools. When you begin to understand how subtle or even invisible hypertension can be, you become more proactive and more protective of your long-term health. If you have noticed recurring headaches, unexplained dizziness, visual changes, or unusual fatigue, it is wise to have your blood pressure checked and discuss your concerns with a healthcare professional. Early awareness brings peace of mind, and if your numbers are elevated, it gives you the valuable opportunity to address the issue before it quietly places extra strain on your heart and blood vessels. Preventing high blood pressure is truly one of the most powerful things you can do for your long-term health. And the encouraging news is that many of the steps are simple, practical, and completely within your control. The foundation of prevention begins with daily lifestyle habits that support your heart and blood vessels, rather than quietly straining them. One of the most effective protective steps is being mindful of salt intake, because excess sodium encourages the body to hold on to fluid, which increases the pressure inside your blood vessels. This does not mean food has to become bland or joyless, but it does mean becoming more aware of processed and packaged foods that often contain hidden salt. Alongside this, regular physical movement plays a remarkably protective role. When your body moves consistently, whether through walking, light jogging, cycling, or even active household work, your blood vessels stay more flexible and your heart becomes more efficient at pumping blood without excessive force. Over time, this natural conditioning helps keep blood pressure in a healthier range. Maintaining a healthy body weight is another quiet but powerful form of prevention. Extra weight means the heart must work harder to supply the body with blood, and reducing even a modest amount of weight can ease that burden significantly. Sleep is another area that deserves more attention than it often gets. Poor or inconsistent sleep can disrupt the hormones that regulate blood pressure, so creating a calm nighttime routine and aiming for steady, restful sleep can make a meaningful difference. Managing stress in a realistic and sustainable way is equally important. Modern life is busy and often demanding, but finding regular moments to slow down, breathe deeply, or engage in relaxing activities can help keep the body from staying in a constant state of tension that may gradually push pressure upward. Regular blood pressure checks are also a key part of prevention, even when you feel perfectly well. Think of these checks as early warning signals that allow you to respond before small changes become larger concerns. Limiting excessive alcohol intake and avoiding tobacco exposure also support healthier blood vessels and reduce long-term strain on the heart. What I want you to remember most is that prevention is not about perfection. It is about consistent, thoughtful choices repeated day after day. Small adjustments made now can quietly protect your heart for years to come. You do not need to change everything overnight. Start with 1 or 2 realistic improvements and build from there. Your body responds remarkably well to steady care and attention. By staying aware, staying active, and staying connected with your healthcare provider, you give yourself a powerful advantage. Take these steps not out of fear, but out of respect for your future self. If this conversation helped you see your health more clearly, take a quiet moment today to check in with your habits and consider sharing this knowledge with someone you care about, because protecting your heart is one of the most meaningful investments you can ever make. Treating high blood pressure is not about one quick fix or a single pill that magically solves everything. It is a steady, thoughtful process focused on bringing your blood pressure down safely and keeping it there long term. The good news is that hypertension is very manageable when it is approached early and consistently. Treatment usually begins with lifestyle adjustments, because your daily habits have a powerful influence on how your heart and blood vessels behave. Simple changes such as reducing excess salt in your meals, becoming more physically active, improving sleep quality, and managing stress can significantly lower blood pressure for many people. In fact, some patients see meaningful improvement just from these steps alone when they are applied consistently. However, if blood pressure remains elevated or starts at a higher level, your doctor may recommend medication to help support your body. These medicines work in different gentle ways, some helping your blood vessels relax, others helping your body remove excess fluid, and some reducing the workload on your heart. The goal is always the same: to reduce the constant pressure inside your arteries and protect your organs from long-term strain. It is very important to take any prescribed medication exactly as directed, even if you begin to feel completely normal, because blood pressure often improves quietly in the background. One of the most common mistakes patients make is stopping medication too soon, simply because they feel fine. But hypertension requires ongoing management, not short-term treatment. Regular follow-up visits with your healthcare provider are also an essential part of treatment. These check-ins allow your doctor to monitor your numbers, adjust medication if needed, and make sure your body is responding well. Home blood pressure monitoring can be especially helpful because it gives a clearer picture of how your pressure behaves during everyday life, not just in the clinic. Alongside medical care, continuing healthy habits remains extremely important even after medication begins. Think of treatment as a partnership between your daily choices and your medical plan. When both work together, the results are much stronger and more stable. Many people live full, active, and energetic lives with well-controlled blood pressure once they commit to consistent care. What matters most is patience and persistence. Blood pressure does not usually come down overnight, but with steady attention, it can be guided back into a safer range. If you have been diagnosed, or even if you are simply concerned about your numbers, take comfort in knowing that you have effective tools available. Stay connected with your doctor, stay consistent with your plan, and stay kind to your body. Every small step you take today is an investment in protecting your heart, your brain, and your future. If this message resonated with you, take a quiet moment after this video to check your blood pressure. Talk with your healthcare provider if needed, and share this knowledge with someone you care about, because awareness and timely action can truly change the course of your health journey. As we come to the end of this conversation, I want you to take a quiet moment and simply breathe, because understanding your blood pressure is not meant to create fear in your life, but to give you clarity and control. The truth is, many people live for years without knowing what is happening inside their bodies, and by choosing to learn about hypertension today, you have already taken a meaningful step that many never take. Your heart works for you every second of every day without asking for attention, without taking breaks, faithfully pushing blood through miles of blood vessels to keep you alive and active. Giving a little attention back to your heart is one of the kindest things you can do for your future self. Remember, high blood pressure is common, but being unaware of it is what creates the real risk. When you stay informed, when you check your numbers regularly, and when you make small, steady improvements in your daily habits, you shift the direction of your health in a powerful way. You do not have to be perfect, and you do not have to change everything overnight. What truly matters is consistency, awareness, and the willingness to listen to your body before problems grow silently in the background. If something in this video made you pause and wonder about your own blood pressure, treat that feeling as a helpful signal, not something to ignore. Consider checking your blood pressure soon, either at home or with your healthcare provider, just to give yourself peace of mind. And if your numbers are higher than expected, remember that you are not alone and that this is a condition millions of people successfully manage every day with the right support and steady care. Your health journey is not about fear. It is about staying one step ahead with knowledge and calm, confident action. If you found this helpful, I gently encourage you to share this information with someone you care about, because one simple conversation can sometimes protect a life. Stay aware, stay consistent, and most importantly, stay kind to your heart, because the small choices you make today quietly shape the strength and safety of your tomorrows.